The Connecticut Hospital Association is pleased to present the 2013 John D. Thompson Award for Excellence in the Delivery of Healthcare Through the Use of Data to Western Connecticut Health Network for its multidisciplinary, multi-hospital, community-based program to improve the treatment of patients with ST elevation myocardial infarction.
Door-to-balloon time is the time from when the patient with a heart attack arrives at the emergency room door to the time when the occluded artery in his heart causing the heart attack is open. And shorter door-to-balloon times correlate directly with improved survival. We started this program in 2005, and since this was a known important metric for quality, we established a multidisciplinary team involving physicians and nurses from cardiology, the cardiac catheterization lab, and from the emergency department, along with people from performance improvement, clinical pathology, and our EMS colleagues, since they're such an important part in getting the patient here as quickly as possible. And we developed a data form that had over 35 distinct time points that follow the patient from the moment he arrives at the hospital door to when we get the artery open in the cardiac catheterization lab.
And we'll actually take a look at the individual components of that time and try to assess how each minute is spent during the delivery of care.
Part of the idea of providing the right care at the right place and the right time is that initial 911 call. We want to be able to get information from the caller, whoever is having the medical emergency, so we can get out there in short order, make a quick diagnosis, send the 12-lead EKG, and by doing that, our catheterization team has been mobilized and ready to receive the patient.
And if the person was having a heart attack, we could have them pass New Milford and go straight down to Danbury Hospital to get to the cath lab in the shortest amount of time.
By communicating with our EMS providers early on, we know what's going to be coming in the ambulance bay doors. We can expedite the care that's given in the emergency department so that we can partner with our cardiologists upstairs so we can move this patient very quickly through the process.
And we've shown improvement since 2007. Over the past few years, we've had a decrease in our off-hours door-to-balloon time for people who walk into the emergency room of 25 minutes. So we've improved their door-to-balloon times almost a half hour. And for patients arriving via EMS providers, we've actually improved our door-to-balloon times by over 30 minutes because we've allowed the EMS providers to activate the team from the field before the patient even gets here. So we can be prepared to receive the patient even before they get to the hospital. You know, it's really an incredible feeling for all of us, and I think we all take pride in being part of this team and making a difference.
The most important thing to me as a caregiver is that we can improve the quality of patients' lives. To be able to take someone to a definitive procedure in under a defined period of time, you're able to actually impact the quality of the remainder of their life. To be able to take someone who otherwise may not have been able to attend their son or daughter's wedding or their grandson's high school graduation and now know that they're going to physically be able to be there and enjoy that aspect of their life, that's what it's all about.
I think this project has been a tremendous success, and I'm very proud of the team for its work. I think on some level it reflects the organization's vision, or at least a part of the vision, which is to create an environment of continuous learning, discovery, and innovation. In many respects, I think that's what this project represents, is that they saw what could be better, they really studied it, and they constantly innovated to find ways to continue to improve. So again, I think the results are exhilarating, and it reflects our commitment to that vision. I think on another level, it speaks to our values, one of which is teamwork. I think if you really study the success of the project, you recognize that many people work together really as a team to achieve these extraordinary results. Physicians, nurses, PAs, nurse practitioners, paramedics, EMTs, volunteer firefighters, and other members of the first responder community, as well as our donors. 2 hospitals and its administration, and these 2 hospitals, at least historically, have not been partners until the affiliation in 2010. And I think what's remarkable here is that team was formed and we got beyond the politics, the silos, and the turf wars. and really did what's right for the community. I think this project reflects our ability to improve the health and well-being of the communities we serve. And that's precisely why we're here. That is our mission. And we're very grateful to CHA for having recognized this important work.